Good afternoon, everyone. Thank you for joining us at our Data Stories series. Today, I ask that you all stay on mute up until the end of the presentations, and we'll allow for some Q&A. Today, we have Chris Whaleman, who will be sharing, the topic is Oral Health Needs Index, and I will give it on to her.
Good morning or good afternoon, everyone. Thank you for taking some time today and joining us for this data series. My name is Chris Whaleman, and I'm from Hope Health Community VNA. We're a visiting nurses association out of Attleboro, Massachusetts. We were chosen to do a small case study for the conceptual model that I'm about to present. So Bianca's going to put up the slides for us. So the Elder Dental Program is provides quality, affordable health care to low-income seniors who are 60 and older, who live in 23 communities in Massachusetts through a network of community volunteer dentists. There's also another part of the program where I plan 2 free oral cancer screening clinics. The program itself is an income and asset-based program. The fees that the patients pay is on a sliding scale for their dental care. The clinics are open to anyone 60 and older, completely free, and there is no income or asset qualifier for the clinics. So for the data story piece, we focused on the free oral cancer screening clinics, knowing that a certain percentage of the people from the clinics would then convert and become members of the Elder Dental Program itself. It's 100% grant funded, and I already talked about the clinics, so we can advance the slide. So Critical Learning Systems and the Fuller Laboratory for Spatial Technology at Middle State Tennessee University and the Mental Consulting, Inc. helped develop this Oral Health Needs Index mapping tool that would provide meaningful data to transform oral health. The Oral Health Index model was created as a case study conceptual model, and it focused on achieving oral health equity through increased data availability, capacity building, and using the visualization mapping. You can advance the slide. The process. So the OPENS blueprint levers that were identified were bringing care to people, and there was an emphasis on prevention. The equity factors that were considered were available transportation to the free oral cancer screening clinics, and were the clinics conducted in the best area town to maximize the community's participation. You can advance the slide. The methods. We're going to play, this is a 4-minute video. We're only going to play just about 2 minutes of it. This gives you the background on how they put together the pieces of it using Z-scores, which is a little out of my zone, but go ahead.
Hello, everyone. Dashboards and story maps. Factors important to each community story map are variables and data sets added by community organizations and community members. They tell their own stories. The maps and social determinants of health and elder access to dental providers allow interactive evaluation of where people aged 65 and older live in relation to dental providers and public transportation routes, and whether the census tracts they live in are potentially vulnerable areas based on the case study Social Determinants of Health Index. These data visualizations can be used to evaluate and prioritize elder access to dental providers in the case study area. The case study story map for the Elder Dental Program focuses on access to dental providers for populations aged 65 years and older in Bristol and Norfolk counties, Massachusetts. Built on Esri's ArcGIS story map platform, the case study story map uses map layers from the data mapping dashboard to present population data, social determinants of health indicators, dental provider locations, and public transportation routes in an interactive digital narrative. Additional story components could be added to the Elder Dental Program case study story map from the data mapping dashboard, such as the locations of long-term care facilities. The case study area social determinants of health index uses both nationally available data from the US Census and locally available data. The method for calculating the social determinants of health index included calculating z-scores for each indicator by census tract to standardized values, finding the correlation between income and other indicators in the set, assigning a sign, plus or minus, to each indicator based on correlation to income, adding the z-scores for each census tract to represent a comparative value of social determinants of health distress or vulnerability.
Thank you. So if you have any questions about the Z-scores and comparability, I will take the questions, but I will have to have someone else get back to you about them because I wasn't the one who did that. I'm the programmatic person. So I wanted to just talk a little bit about the tool. This is the storyboard. So there was a storyboard for each Norfolk and Bristol County, which I work in Southern Norfolk County, so it's not the whole of Norfolk County. We felt like the storyboards were not fully utilized, and the feedback that there was just a lot of information on the storyboards and that it wasn't local enough to the area. And we're going to hop into the storyboards now, I think. So I think it's the first link. Can you see it? Oh, no, there it is. Okay. Yep. We're going to back up a little bit. Yeah, up. That's it. Okay, good. Okay, so the social determinants of health or community conditions and the health and quality of the life of the community members. And for this case study, we used 7 variables here. We used median age, per capita income, percent of adults without a high school diploma, food insecurity, percent of adults without health insurance, and percent of households without an access to vehicle. And this is based on census tract data. We focused on people that were 65 and older in the 2 counties, Norfolk and Bristol. You can scroll up and keep going. Yep. So this is where, when I was doing presentations for the storyboard to various groups, it felt like a lot of information, and it just felt like it was too heavy for just that was the feedback that we got. You can scroll through this rather quickly if you like, because we'll give the link. So if you want to go through it a little bit slower, that's fine. Plus this one says the median household income, if you look here, is 104,000, which in the area that I worked in, that so Norfolk County encompasses the city of Boston, and the city of Boston probably has a higher annual income than the areas that I work in, Southern Norfolk County. So it wasn't really a home run for us to say. So, okay. So once we did put in those 7 areas, we came up with an index value. If you go up just a little bit more, Bianca, I think the index value will come in here. Okay, yep, there's those 7. Okay, so now you can see the deeper the blue, that's 8 to 13, and then a little bit, that's the deepest blue, and then a little bit lighter blue is 3 to 8, and then it goes down to almost a pale green. That is, those areas in the census tract have the highest levels of distress or vulnerability based on the 7 social determinants of health indicators. Okay, can scroll up a little bit. Now what we did was we, through the census tract information, we put in people that were 65 and older. So the larger the red dot, the more people reside in that area that are 65 and older. You can scroll up. Then we overlaid transportation routes. So these were public transportation routes that were available to all the people in those census tract areas. And that looks like spaghetti. Then we have here, the green dots are based on NPI numbers. So the national provider numbers for anyone who has an NPI number that's dental. And the unfortunate thing is that also drew in labs, dental labs, and those in our Commonwealth, we don't treat in dental labs. I know in some states, dental labs can treat, but it's a pretty fair representation of where the dentists are. I think that's good. Yep. Okay. So now we're going to jump right into the tool. So that explains just a little bit about what you'll see on the tool. Now we're going to jump into the tool, and this is where you can overlay some layers and choose what you want. So if you go up to the layer button, right, we have Rehoboth. Are we in at Rehoboth? Can you stick on, yep, not long-term care, put on Southeast Regional Trait, yep, Greater Attleboro and Brockton, please. Brockton Transit Area too. Yeah. And social determinants, and then percent over 65, and we want dentist on. I think you scroll up a little bit more. Yep, there we go. Okay. I think you can get rid of that box. So if you see, one of the areas that we looked at was Rehoboth, Massachusetts. As you can see, it's got a fairly deep color green. And it's got a fair number of red dots around it. So people that are 65 and older. It's got a few dental practices, but it had virtually no transportation routes into that census tract area. It's a little hard to tell. I think one of the things that I would have changed in helping design this is I would have had a map overlay of the towns, because when I talk to people, we don't talk about census tracts, we talk about towns. So it's a little hard to see exactly where Rehoboth is, but you can see that blue box where Bianca has the mouse, I guess. It approximates Rehoboth, Mass. So in planning our last clinic, we reached out to the veteran service groups. I did presentations with the Medical Reserve Corps, the Rotaries, and then there was a Social Responsibility Alliance that I did a presentation with, and I showed this information about that's a dental desert in terms of people 65 accessing. They have few providers around them, but in terms of them accessing dental care. So it came down to, would we put a clinic there, or would we help find transportation for them to maybe transport to a clinic? So in discussions that we went through, we decided that we were going to access unused capacity for the Council on Aging van. The clinics that I perform or that I host, they happen on Saturdays, and by and large, unless the Councils on Aging are having a event that they need the van for to drive them to place, they can free up the van for something like this. So I worked with the veteran service officer and the public health nurse in that town, and we were able to reserve 9 spots on the bus for people to be transported from Rehoboth to Attleboro, Massachusetts, which is where I had the clinic. And happy to say all the spots were filled until the morning of, and then we had one person that had contact with somebody who had COVID. So they decided not to come on the bus. I think we would have also had them not come. So that was a successful use, I think, of presenting the data to community partners and making an impact in a town where we identified a dental desert in terms of transportation for people 65 and older. Okay, I think if you wanna, can you just spread out the map now? We can take Rehoboth off, thanks, yeah. So the other thing we were looking at was, well, a little bit in. There, yeah, that's probably good right there, thanks. Another thing we were looking at was future planning of clinics. So we wanted to sort of see where it would be best to put clinics for future planning. And we've identified the area. Can you zoom in a little bit on Fall River? You can see it down right at the tip. It's sort of a big one, yep. So they have a very wide network of transportation, and they are fairly deep blue. So that means that that census tract area has some distress in it, and they have a significant number of the red bubbles that would indicate that the people are 65 and older. So we're using this both prospectively to plan our next clinic, and we also used it to identify areas of the dental deserts. We're using it for presentations, and it does make an impact on the different groups that I've presented to. It really is a good way to visualize the data of why we're putting it there, or why we're asking for support for a van to be able to transport. You can see it in a clear, concise kind of way. I also wanted to just talk about, I think, can we go back out to the slideshow? I think we're all set with that. Okay, in advance. So we informed decisions, we showed gaps in transportation, we use it to educate local funders, and we built on the existing capacity at the councils on aging, which I already discussed. You can advance the next slide. So I also just wanted to say that one of the things that we're working on right now is this is built on ArcGIS platform, which I'm not very familiar with. Apparently it has to be hosted at a university or a college, because I'm gathering from the information that I've got, it's a very expensive sort of GIS mapping program, and it seems that there's more local colleges. So I'm partnering right now with Harvard University, trying to get it moved off of the server at Middle Tennessee State University and moved up to Harvard, so we can work on it a little bit more, because the data that was in that was from 2000. I think some of the census tract data was 2018, because we started working on this before the pandemic hit, and then the pandemic hit and everything, stopped for everyone. So just as a caveat, if you're going to do some of this data research with GIS stuff, just know where your support is in terms of GIS students that can work on this, unless you have a background in it. And I think we'll open it up to questions now.
Please feel free to unmute yourself or put it in the chat. And if there are any questions. I will also drop the second tool, the link, excuse me, the second link to the tool, to the last tool we were just showing as well. And there's also an evaluation link that we pretty please ask that you fill that out as well. Any questions for Chris? You have a great presentation. Thank you, Patty. I'm saying thank you on behalf of Chris, that is.
This is Walita Watson. I got in maybe 10 or 15 minutes a little late. I'm trying to get some understanding as how you begin the process of understanding this geographical, spatial, what do you call it? Give me the name for
Oral health needs index.
Yes, yeah, right. Let's see, I'm not looking my best, but I do here. I'll put a face to this.
That's okay. None of us look the best when we're zooming from home.
It didn't like me, so I lost you all together. I put it on there and then you went away. So anyway, I'll talk. I can't get back. I'm trying to understand the Oral Health Needs Index. I'm interested in that. How was that created, and where did you go get this information? And how did you determine the social determinants of health in the 7 categories? And if nothing else, send me something as an email while I try to find y'all again. disappeared. I don't know what's going on with the system.
Can you hear us, Ms. Wasson?
I can hear you. Maybe I can
Okay.
do.
Well, I'll talk to you a little bit about it. So,
Oh, here I am. I'm back.
okay, so Dr. Houston from Critical Learning Systems, she was looking for a program to do a small case study. So this was a concept that I believe Dr. Houston had come up with some people, but she needed a program. You know, she had a concept, but she needed a program to kind of fit in with it. And so my program seemed to be a good match in that it's a small enough program. It's only 23 towns in Massachusetts that I cover in terms of helping seniors with dental care. It was also, you know, it was restricted to, in my program is 60 and up. Census tract data was 65 and up. So a bit of a discrepancy there, but not huge. Also, I had already had some contacts with the public transportation people because I have worked on these clinics for the past 5 years. So I already had some contacts with them. So I think all of those things helped make it a good match for Dr. Houston and my program for my program to be chosen as the conceptual model for this oral health needs index. So she did the bulk of the work. In terms of finding the community partners that would do the indexing model. I obviously gave my input on the 7 areas. Like, so if you're working with children, you obviously don't want people, your census tract data may be the same, but you don't want people 65 and older. You probably want, you know, 18 and under maybe, or something like that. So, you know, you would choose them as you put them into the model. You would choose what would fit your program. Mine was 65 and older. I don't know if that fully answers your question. It's, you know, I was chosen is pretty much the answer. You're on mute. I can't hear you. Miss Wasson, I can't hear you. Are you talking to me? You're on mute. I can't hear you. Oh,
Can you hear me now?
I can hear you now.
I tell you, once I learned one Zoom, y'all switch to something else. And this one that you have is, for me, is not user friendly, but that's my issue, I guess. This Ring Central. I guess I'm confused as to how do you get this index, or where do you go get the index?
Well, so we're going to put the index in, I think Bianca's got it already in the chat, and we're going to send all the participants the PowerPoint slides so you can click on the index, but the index would only be for Massachusetts. So if you're interested in learning about Massachusetts and what's going on in Massachusetts and applying the layers, there isn't an index that you could put in you can't put in another town. The index is just specific to Massachusetts.
So how can we get the program that we can put in our own things, and where do I get that?
I guess you'd have to talk to Dr. Houston to see if there's something that she can do in terms of putting it together, because she was the one who put the, you know, the spatial relation. She put the relationships together that was through Middle Tennessee State University, Mental Consulting, and Critical Learning System.
Okay.
Those were the three people that really put together the index, and I gave input as the program as the dental person and the program manager. I had input into what I wanted to see there, but as far as putting it together and doing the Z scores and all of that, I had nothing to do with that piece of it.
Okay, so it's not available for everybody. This is just the first phase of research. Are they planning to put this as a social determinants of health format that's open to everyone?
I believe it's just a conceptual model, and they wanted to see first, you know, was it going to work? Was it going to answer the questions for my program that I needed it to sort of try to help us answer? And how useful was the data how useful did I find the data? And how useful did the community partners find the data? So then to maybe move it on would be a question for Dr. Houston, whether there's more funding there to expand it beyond Massachusetts, or, those would be questions for Dr. Houston, I think.
I've added Dr. Houston's contact email address in the chat as well.
Oh, okay. I'm having trouble finding the chat. Maybe you can send it in an email. This Ringer Central is not user friendly for me. It seems like I'm not having a good IT day with anything.
No, it's not just you. Ring Central has a history.
Oh, okay. All right. So I'm interested in a particular project. I'm in the Mississippi Delta area, Memphis, Tennessee. We high on all chronic diseases, and I'm interested in it for all age groups. And I'm looking at it from various perspectives for all systemic health. And so it would be interesting if this is the only one out there. Are there other programs similar to this that is already developed that would be of use? Would anyone know?
I don't know of any.
Oh, okay. It'd be interesting to talk with the individual. She is no longer at Middle Tennessee anymore. Is now at Harvard.
No, so no, she's never was at Middle Tennessee. Dr. Houston sort of arranged all the people, put all the players together to build the model, and me being one of the players. And now now they're done with the conceptual model, and now I sort of own it. And now I'm gonna find some place to kind of have it sit on a server so that it can be updated, like the NPI numbers. Some dentists retire, new dentists graduate, so you need to update the NPI numbers and things like that. So I needed to find some place to go and have it moved to, and so now I'm partnering with Harvard to have it moved there on their GIS, because apparently to purchase an ArcGIS system to be able to basically kind of write this programming is you've got to have knowledge of that, and you've got to have funds to be able to purchase that, and that's not something obviously our company is interested in, because we're a visiting nurses association.
So how would I use this? What is the purpose for me in understanding this model if I'm unable to get it to what I'm supposed to do with this information that you've given us today? How can I take this forward for future projects?
I think it's because it's a conceptual model. It's just the first one out the gate. And so I think there'll probably be other models along these lines. It may not be made with the ArcGIS system. I think that it's just to give you an introduction of how you can use this type of visual mapping to identify areas of dental deserts, or identify areas where you want to focus your oral health efforts. So I think it's just more planting the seed sort of right now than it is for something usable for you, anyone outside of Massachusetts.
Okay, well, I was looking at it just because I was on a dashboard a couple of days ago, and I'm looking at so many things now. And that one seemed to be similar to what you're doing. You go in and you put in your zip code, and I could tell the number of people in the area. I could tell the economic area in the area. I forgot which one. I put it in my, so that's why I was asking was something else out, because it was, I could go to the state of Tennessee, Memphis, Tennessee, put in my zip code, and it could tell me the life expectancy of me in my area. And others, plus other information. And that's why I was asking you what made this different than that one and a couple other dashboards that were similar.
I don't know the other dashboard you're speaking of, so I don't know if I can say anything, but I think maybe the open network might be a place that you could post that sort of a question, because people may know more about those other dashboards. So to be able to give you an answer on a dashboard I've never been on, and I don't have a good answer for you.
I just stumbled on it and I thought it was interesting because they could look at the life expectancy of a person in the area. And I was just interested in it because I thought it was errors in it because it said that some people wouldn't live past 72. And I knew like 25 people that live past 72. So I'm thinking, okay. But anyway, thank you for that information.
You're welcome. And I see a question in the chat. Is that what you're going to tell me, Bianca?
No, go ahead.
So somebody's asking, is there a short social determinants of health survey that we can use with our clients to identify social determinants for our clients and service area? There isn't one that I know of, but perhaps if you post to the open network, maybe someone does have a tool that would be more towards the clients. And I don't know if you're still on. Are you asking the clients, like, do they have issues with transportation? Or are you asking about oral health status? I'm not, or any of them.
Yeah, this is Sister Roberta. I manage a dental program here in Emmitsburg, Maryland, and I do a pre-service and a post-service survey. Some of the questions are those social determinants of health, but I know that I'm not catching everything like transportation and housing and such. I'm leaning more towards, do you have a doctor? When's the last time you went to the dentist and things like that? But I know that we can gather a lot more good data when we kind of branch out to those other social determinants of health, not just for my dental program, but for our other outreach areas where we want to identify, a lot of the gaps, because we are a rural area. We have 2 dentists, both of which are close to retiring and probably just sticking around because there's nobody else. Transportation, the bus leaves here early in the morning if you want to get to anywhere that has anything, and it doesn't return until late at night. So there are a lot of issues in our area, and if during our intakes we can go ahead and do those surveys, and as we either report to our funders or talk to our town councils or whatever, that we'll have some real information that we can talk about. These are people in your town, and these are some of the obstacles that they're running into. I mean, I don't want to recreate the wheel if there's a wheel out there. There's got to be a questionnaire out there, because you've got the data on that map. I just don't know how you got that.
So I can tell you that some of the data that's on that map, census tract data, is the one that we pulled into, and we gave those 7 variables to the census tract to give you a color to sort of make it, the more vulnerable, the deeper the blue. And then it was NPI numbers, it was public information on transportation routes, and then the dot, also the red dot, that was people 65 and older. That was also census tract data. So a lot of this data was, census, it's public data. It's having someone know how to go in and get that census tract data and then put it into a program and, sort of make it work for your town or your area, whatever. So I know the data does exist out there, some of that data. I don't know if, I think that you probably could ask someone on open if some of that data, like you were asking about transportation and things like that, for the individual. I don't know about a survey, but I think that someone on open may have, some answers for you.
Awesome. Thank you, Chris. We're a little over time. So
Yeah.
thank you very much for your for all this great information. I will be sending this back out. Please take the evaluation survey And please feel free to reach out to myself or Chris, and I will drop her email in the chat. If you have any other questions.
Thank you, everyone, for your time today.